Welcome to week 11. This week we are focusing on autism spectrum disorder. In 1943, Leo Kanner gave the name autism to the disorder, or autistic, which means to escape from reality. Previously, people that ended up being labeled with autism were thought to be schizophrenic or some other mental disorder. They were labeled an idiot, an imbecile, because it didn't really have a definition or know what autism was at the time. Leo Kanner did a ton of studies on this population of people, and he differentiated autism from schizophrenia in three different areas. An extreme aloneness from the very beginning of life, an attachment to objects, and a powerful desire for aloneness and sameness. The current IDEA definition is autism means a developmental disability significantly affecting verbal and nonverbal communication and social interaction, usually evident before age 3, that adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotyped movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. On this slide is the DSM-4 criteria for diagnosing autism spectrum disorder. There is obviously a ton of information. I'm not going to read through it, but you can pause this slide and take a look at just the criteria that psychologists use to diagnose autism in their patients. So autism and Asperger's. The DSM has 3 defined levels of autism, which, if you remember, we talked about RTI in the classroom, response to intervention. It's very similar to the 3 levels of autism. So the lowest level just means that they require some support. Level 2 means they require substantial support, and level 3 means the student with autism requires very substantial support. Asperger's is just a very high level functioning of autism. It is a social disorder. They generally have no language development issues, but they have a hard time with abstract thinking and a very hard time taking social cues when speaking with other people or communicating with others. People with Asperger's generally have an average to above average IQ. The book talked about 3 different theories on why they thought autism happened in children. The first one is a psychogenic theory. They thought that babies who didn't have an attachment to their parents will not be able to form attachment to anyone else later in life. Also, the psychogenic theory thought that bad parenting was the reason that kids had autism. The organic theory is that autism may be organically based and that the mother's behavior was a reaction to the child's condition. And the biological theory is that a child with autism was not properly conditioned by their family from infancy on. The prevalence of students with autism seems to be climbing every single year. I looked on the CDC website, and the most current statistic that they have from 2024 is 1 in 36 children is diagnosed with autism. It is 4 times higher in boys and in girls, so 4 in 100 boys are diagnosed and 1 in 100 girls are diagnosed. The prevalence of autism in the United States has increased by over 1,000% since 1970. In 1970, it was 1 in 5,000 people was diagnosed with autism, and now, like I said before, it is 1 in 36 children. Obviously, with the prevalence of people being diagnosed with autism rapidly on the rise, scientists are doing a ton of different studies to figure out the etiology of autism and what some contributing factors may be. The primary suspected contributing factors are genetic predispositions and abnormal brain chemistry. Also environmental variables and complications during pregnancy. So scientists are doing a ton of different neuroimaging studies on people that are diagnosed with autism to see if there are places in the brain that they can pinpoint that have specific abnormalities. Currently, the cerebellum, cerebral cortex, and brainstem are some of the regions in which anomalies are being investigated. Autism spectrum disorders are not the result of abnormalities in just one specific location, but rather multiple regions of the brain are likely involved. There are a ton of different things. If you Google um, the causes of autism that people are studying, whether it's food dyes or food sugars, there's a lot of different things that parents are studying or doing studies on to try and figure out why their child has autism. But if we look at the scientific research, currently it's coming down to different areas of the brain. Some characteristics of people who have autism spectrum disorder. Intellectually, they have a wide range of functioning. Autism, I know I say this about pretty much every disability, but autism is a huge spectrum. Um, Ranging from super severe autism to people that are very, very high functioning and living a normal life. So intellectually, it's all over the board. 30% have some degree of intellectual impairments, and 10% are considered savant, which means they have very, 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 very high skills in a specific area. Um, Only 1% of people without autism are considered savant, but 10% of people with autism are considered savant, which I thought was fascinating. Another characteristic, social interaction. So that's generally an early indicator of kids who have autism, a lack of eye contact when you're communicating with them, little expressed pleasure while interacting with them, limited use of nonverbal cues. They do not readily learn by observing others, and they're very, very black and white in their conversation, which also leads to the theory of mind. So the theory of mind is that people with autism struggle to see that others have a differing point of view than they have. So they believe that kind of the world they're living in and their thought processes are the only thoughts that one should have, which tends to impede their social interactions with others because they have a really hard time seeing that other people can have their own point of view about the world or different thoughts and perspectives than they have. The more characteristics that people on the autism spectrum have for their communication, they may have a delay in receptive and expressive language, an improper use of pronouns, marked impairment in conversational skills, or echolalia. Echolalia is that some students with autism the only language that they have is things that they've heard. So echolalia means that they hear something and they repeat it. So they'll talk in phrases that are repeated of things that they've heard, whether it's from an adult, a child at childcare, something on the internet. Um, I have really funny stories about this. I have a student with autism at the school I'm currently working at who's obsessed with YouTube and YouTube videos. So most of his conversation is repeating different quotes and things that he's seen on YouTube, which aren't always the most appropriate. So it is quite frankly some of the best parts of my day having conversation with the student because it is never super appropriate and it's always hilarious. Repetitive or restrictive behaviors. So a lot of times they will play with the same toys, be very rigid about their routines. A lot of times people with autism, if you break their routine is when you're going to start seeing behaviors because they're very rigid about having the same routine at the same time every single day. A lot of kids with autism eat very few foods. They're very specific about the foods that they eat, about their textures, about their taste, sometimes about their temperatures. Sometimes students with autism are insensitive to pain, so they either don't feel pain or they just don't react when they are hurt, which tends to be kind of scary sometimes. Um, Sometimes they are unaware of danger or situations that could cause harm to them. They may show unusual attachment to inanimate objects. One of my kiddos has to carry around a very specific Finding Nemo blanket all day, every day. That's their attachment to their favorite thing. And some students exhibit repeated body movements, so things such as hand flapping, finger licking, rocking, spinning, any sort of repeated behaviors like that are things that we very typically will see in school with our students with autism. Assessments for students with autism. So we don't use an assessment to diagnose autism. To diagnose autism, it is a screening and more a checklist than an assessment, but we do use assessments, intellectual assessments to be exact, to diagnose if a student will qualify for special education. Just because they have an autism diagnosis does not mean that they will qualify for special education. Some students with autism can function fine without an IEP, but we will use an intellectual assessment to diagnose if they qualify for special education and what services that they will qualify for. And like I said, it's more of a screening for a diagnosis, a two-part screening. So there'll be developmental screeners. So I have a 2-year-old son. Every time we do a milestone checkup for them, I have to do the ages and stages questionnaire, the ASQ, online before I get to the doctor, which helps detect autism in students and children up to 30 months old. And then if something gets flagged on there, they'll have a comprehensive evaluation done, again, by a multidisciplinary team. So it's more than one person. It's generally a whole team of people that will do their own assessments and screenings. Screening for Asperger's. So the screening that they give to children for a diagnosis for autism may not actually diagnose children that have mild to high functioning autism or Asperger's. So there are specific screeners for Asperger's. Some strategies on educating our kiddos with autism. I am going to tell you to go back and look at the book for this part. There are pages and pages of different strategies to use because these kids are all so different and the spectrum is so wide. Not one strategy is going to work for every student with autism. Not two strategies are going to work for every student with autism. All the kids are so different. So for time's sake, I'm just going to tell you to go back in the book and take a peek. Some things to highlight: that 40% of students with autism are in the general education setting for 80% or more of their day. So if you're in the school setting, you are going to see kids with autism being educated in with their peers like they should be. Some effective instructional approaches to teaching our students on the spectrum. Be structured, be predictable. Individualized instruction is extremely important and effective for these kiddos and geared to the person's level of functioning. I will highlight predictability is extremely important. Our kiddos with autism like to know exactly how their day is going to be structured, and if there's a change in the day, they need to know about it beforehand, or generally we see behaviors arise. It's the transition part of the day or the unstructured part of our day that we see a lot more of the behaviors happen. Lunchtime, in between classes, anytime that there's a transition is really tough for our kids with autism because it's not as predictable as the classes that they're sitting in. Early intervention is absolutely crucial for kids labeled with autism. Like I said, when you bring in a baby for their milestone checkups, you do the ages and stages questionnaire, um, which obviously not all parents are probably going to be honest on, because if you read some of the questions, you're like, oh, my baby's not doing that yet. But a lot of parents will likely be like, sure, they're doing that, because they know that they don't want to think that their child is behind. But the early intervention is huge. If we can identify them early enough, we can get them birth to 3 services. Birth to 3 offers a ton of different things, such as nutrition services, OT/PT, speech, which is very, very important to get ahead on. And then the birth to 3 services will end up turning into early childhood services at the school level. When early intervention is possible for our kiddos, our future outcomes are far more great than those who don't get their early intervention services in time. A lot of the technology that is used for our kids with autism is based around communication, because obviously communication can be a barrier for a lot of our kids with autism. The first one is an AAC device, which we discussed in our assistive technology chapter, but it's just a basically on a tablet, which is used for a speech generating device. It has different apps on it that kids can use to communicate with others. The PEC system is on the slide. That is more of a low-level technology serving the same purpose as an AAC. But the kids are able to manipulate their day. Usually they'll have a book of these little pictures. They'll be able to flip through their book and try and find what they are trying to communicate to the person they are talking to and be able to pull it out and put it on their board. Computer aided learning, there are a ton of different apps and programs that our students with autism can benefit from on either tablets or computers during their school day. When planning for a transition to adulthood with our kids with autism, the most important part is to make sure that the student with autism is involved in their planning. It's their future. It needs to be based on their current and future wants and needs, their interests, and also taking into consideration their ability level and their competency level. There are a ton of different services available to people with autism around here. The ADRC is the Adult with Disabilities Resource Center. They have resources of all types for people with all varying levels of autism. They are instrumental in helping us plan in the schools for the student to have the best plan possible moving forward on a student's transition plan. There are goals that address daily living skills, their communication and social skills, different living arrangements, whether they're going to live at home with parents or live, in a home somewhere with other people with autism, or live on their own in their own apartment. Post-secondary education is generally on their transition plan if their ability level is there. Community participation, vocational competencies, interpersonal skills, and other things that are appropriate in the workplace. But people with autism can definitely have the brightest future, just like any of our other students. They generally will just need a little extra help along the way. We'll see you next week.